today we can't come full videos. That's why we want to go to school.
Yes, Kitu. How many teeth did you lose?
Hmm.
You lost 4 teeth? No, I can see only 2 teeth this girl. How many teeth did you lose?
4.
4 teeth did you lose. Who removed your teeth, Tina?
Sleaze. He helped me to remove.
How did he help you removing teeth?
Long time ago, Caesar told me my teeth was loose.
Okay.
And Caesar think about. I think he told you will take to the dentist to remove the teeth. No, but Caesar told most things me and doctors in the town will remove your teeth. Then my 3 teeth went down.
Oh, you are happy for that?
Yes.
So, when we talk about removing the teeth, we should give a good credit to Captain Sridhar Nair, who is a neighbor who helps me in removing the teeth. Yesterday, we are going to discuss about how to remove teeth in children, because nowadays parents prefer to go to a dental place or dentition to remove our teeth, whereas our parents used to do this at home. So let's see how to do it. As we discussed before, our children start getting teeth at the age of 6 months of old, and by 3 years you can expect all the baby teeth is completed. And there are 20 primary teeth or the baby teeth a baby can have. By 6 years onwards, these teeth can become wobbly and give way for the adult teeth to come. So here we are giving you some tips how we can help our child to remove the tooth at home, because nowadays parents are very scary to move it, and when the child cries they really don't know how to handle, so directly take the child to a dentition, which is not necessary. And these things from our forefathers onwards, even our parents is done at home. So what we need to do is, first we need to encourage the child to keep on wiggling. So once we are keeping on moving this loosened teeth, this become more loosened, so it's easy for the teeth to come out. So we can keep on reminding our children to move the teeth either with the tongue or with the index finger and the thumb finger, so that the loosening process will be more easier. So if they are doing that, well and good. If they are not remembering, we need to remind them, but I keep on doing that, because that helps for removing this particular teeth. If this way is not working, the additional thing what we can do is, we can give some hard food for them to chew, like apple or pear. These are the fruits which is little more harder to bite, or you can give harder chapati or anything, so that when they bite, that can add on to the loosening process of the teeth. The next way we can help out the child is by giving some cold stuff. We can give an ice bar or anything that is kept on the refrigerator to bite. So what happens? There can be a numbness can happen on the gums, because the child is constantly in touch with the cold item, whatever it is. So this also will help for painless removal of the teeth. Another great method of removing teeth is brushing and flossing. We know that we need to brush the child's teeth or our teeth, but we need to insist them to go for an up and down movement, which again add on to the process of loosening. Also, flossing helps to remove or disconnect the teeth from the gums by loosening the rigidity what the teeth is having. When we are helping them to remove the teeth, we can use a gauze piece, we call it as medical gauze, to grab it and keep on wiggling so that the teeth can be removed. So these are some of the ways we can help our child, and even everyone is practicing the same thing. And when you're moving the more, you can understand the movement of the tooth will be much more, and you can really realize how it is getting detached from the gums, and you can expect little bleeding by the end of it. Don't get scared or don't get feared. It is the last step for the teeth to be fall off. So we should be encouraged or we should be harden our heart so that we are able to help the child by keep on moving and help the child to take out the teeth. If you and I are not able to remove the teeth, because every children's bearing capacity is not same. Some may be able to cope up with whatever is happening, some may not be. If you see, my Enoch is able to bear the pain to a greater extent, whereas my Keith will cry out if we see a syringe. So this is the tolerance difference between the twins. What I'm talking about, how much can be the difference of each and everyone, those who are at home. So if you and I'm not able to manage the removal of teeth at home, then we can approach a dentition where the teeth can be removed by the procedure where anesthesia is given and the pain won't be realized by the child. So these are some of the techniques we can make the child to help or to make the child to remove the teeth as well as help the child. And once the teeth is removed, immediately ask the child to wash the mouth or wriggle the mouth with water or little salt water, and we can give little ice cream or something cold can be given so that the bleeding can stop immediately. So this way we can help the child to remove the teeth at home, and we should appreciate the child. If the child is really cooperating to remove the teeth at home, you need to reward the child amazingly, so that there are so many other teeth need to be removed and you need the cooperation of the child. And always understand the last experience create an impact for the next approach. So how positive you are making the situation, that much good and easy for you for getting the cooperation for the removal of the next two. Hope this is an interesting session. Till we come up with another important topic next week, stay safe and stay happy. Thank you.